Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about that something that remains the number one killer of people in the United States, always has been, always will be, and that is cardiovascular disease, which is almost entirely preventable, which is the sad part about this. But I think most of it's because people think either A, we can control it with medication, so if I have high cholesterol, I'll just take a statin and I'll be good, which is not even close to true. Or, gosh, maybe I'll just have they'll go in, they'll rotor-rooter up there, they'll blow up an opening, and everything will be fine, and we're good, and I can go home and continue to eat fast food and not exercise. Or, worst case scenario, we'll just crack my chest open, do some replumbing, sew it back together, and I'll be fine. We know that that's not true, otherwise we wouldn't still be losing 600 and something thousand people per year to heart disease. And I think the other thing is that most people think, well, it's not happening to me, and I'm here to dispel that myth that unless you have the right choices in your life, there's a good chance that you have heart disease going on right now at this moment. And two things we need to talk about. First of all is something called a coronary CT angiography. It's a way to look at the blood vessels around the heart and looking at whether they're open, whether there's plaquing. And then CAC is coronary artery calcification. So it's kind of a marker. It can give you a score of how much plaquing we have around the arteries. I really like the CAC. It tells us a lot about the health of the blood vessels surrounding our heart. So researchers in Sweden looked at 25,000 people who didn't have heart disease between the ages of 50 and 64. So that would fall into my category. And the had no reference whether or not they had hair, but I do fall into the age category. And they found that 42% of the people had some degree of plaquing around their heart. 42% of people, even age 50. Now, granted, as they start getting older, that was more likely. Men were more likely. But most common, where they found it was in the proximal left anterior descending, which feeds a big part of the left ventricle. The important, the heart's all important, but the left ventricle really pumps most of the blood to our body. And if something happens to that, it's not going to be good. And so most people that had plaquing was found in that particular artery. So overall, this should be a wake-up call for those of you that think that, well, I'm doing fine, I can continue to sit on the couch and eat bonbons because I don't really have heart disease, and that may not be true. Heart disease isn't something that happens today and tomorrow things go south. It's something that develops over the course of years. And unless we wake up and start making changes, it will remain the number one killer of people in the United States and most of Western medicine. And interestingly enough, I need to point out that this was done in Sweden. So we would probably anticipate that if we did the same study in the United States, that those numbers would be higher because we have some of the worst lifestyles in the developed nations. So not something to be proud of, but certainly a factor. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.